Excessive alcohol intake might also cause a person to urinate more frequently than normal and have erection difficulties. Alcohol and medication can occasionally interact, causing negative effects or preventing the medication from working. In this video, we are going to discuss how can alcohol affect an enlarged prostate, alcohol and prostate cancer. Can alcohol mask symptoms of prostate cancer? Drinking alcohol after prostate surgery. Welcome to Medical Made Easy. Because alcohol is a diuretic, it aggravates urinary frequency and makes you feel the need to urinate more frequently. Vasopressin, the more scientific name for the anti-diuretic hormone, is produced less frequently when the toxin is present. Vasopressin instructs the body to reabsorb water, particularly in the kidneys, but now it lets the brain know that you are prepared to leave. Drinking alcohol may narrow the neck of the bladder, which can result in urine retention and a sense of not quite emptying the bladder, even as the need to urinate increases. Acetaldehyde is one of the byproducts of the breakdown of alcohol. After being transformed into acetate, this poisonous byproduct is further broken down into carbon dioxide and water to be excreted. Prostate cancer risk is linked to excessive acetaldehyde consumption, which is known to be carcinogenic. Alcohol causes the body to lose numerous important minerals. This comprises several B vitamins, particularly thiamine or B1, and minerals like magnesium and zinc. These carry out essential bodily processes, and studies have shown that zinc can inhibit 5-alpha reductase, the enzyme that changes testosterone into dihydrotestosterone. Zinc's potential to lessen BPH symptoms may also stem from its apparent capacity to prevent these androgens from attaching to prostate receptors. According to American Society of Clinical Oncology study, alcohol use is thought to be a contributing factor in 3.5% of cancer-related fatalities in the U.S. Numerous cancer kinds are the cause of these deaths. According to this study, heavy and chronic drinkers had a higher risk of cancer than moderate drinkers, and even moderate alcohol consumption may raise the risk of numerous malignancies. It is important to note that the cancer experts were inspired by alcohol's health benefits, but still came to the conclusion that more research is needed on the subject. Stated differently, the evidence is insufficient to support the recommendation that those with a genetic predisposition to prostate cancer should drink alcohol. It's also critical to remember that alcohol consumption raises the risk of numerous other malignancies. Thus, it is important for those who do not drink to abstain, and for those who do, it will be advantageous to cut back. Prostate cancer symptoms can be closely associated with heavy drinking. This may conceal the signs of prostate cancer, exacerbate them, or even postpone getting the right care. These symptoms that coincide are weak urine flow and increased frequency of nighttime urination, fatigue and weight loss, dysfunctional penis, edema or swelling of the legs or feet, pain in the hips, thighs, or shoulders, constipation or diarrhea. Surgery is the most common therapy for prostate cancer, while there are other alternatives as well. Patients who have a reasonable chance of survival are in good health are advised to have surgery. Prostatectomy is the medical name for prostate surgery, which is the removal of cancerous cells from the prostate gland and its surrounding tissues. It is advised that alcohol be avoided for a few weeks following a prostatectomy in order to prevent bladder irritation. Urinary incontinence may result from alcohol use soon after a prostatectomy. In any case, patients should speak with their prostate cancer specialist on alcohol use and any other diet and exercise related concerns following any prostate cancer therapies, including surgery, to prevent causing irritation to the bladder and the consequent urine incontinence. It is unlikely that signs of prostate cancer will appear until a later stage. Doctors utilize screening as a useful method to identify early disease symptoms in individuals with risk factors. Occasionally, a person may experience the following symptoms: increased frequency of urination, especially at night, difficulty urinating, pain or burning sensation during the passing of urine, blood in the urine or semen, difficulty obtaining an erection, pain during ejaculation, and pain or stiffness in the rectum, lower back, hips, or pelvis. Excessive alcohol intake might also cause a person to urinate more frequently than normal and have erection difficulties. Both of these symptoms could be misinterpreted by some as early signs of prostate cancer. Individuals with cancer who make an effort to be strong and healthy generally do better during therapy. Among the advice given are eating a diet rich in fruits and vegetables and low in red and processed meats, exercising frequently, setting aside time for rest and relaxation, abstaining from or using alcohol in moderation. Alcohol and medication can occasionally interact, causing negative effects or preventing the medication from working. Furthermore, the American Cancer Society advises against alcohol use in patients undergoing head or neck radiation therapy. According to the dietary guidelines for Americans, women should limit their alcohol intake to 1 drink per day, and men to 2. Still, experts say it's generally better for your health to drink less or not at all. It is advisable to discuss alcohol with a physician before to radiation therapy or other cancer therapies. In conclusion, despite the fact that alcohol use raises the risk of many cancers, research indicates that moderate alcohol use, particularly red wine, may actually lower the risk of prostate cancer. However, this finding should not be interpreted as approving alcohol consumption. by people whose ancestors had prostate cancer. Alcohol cannot be regarded as a prostate cancer risk reduction unless research has demonstrated its positive effects beyond a reasonable doubt. In addition, it is commonly known that alcohol consumption raises the chance of developing various cancers. That's it for today's video, folks. Hope you liked today's video and found it informative. If you did, please do not forget to hit the like and subscribe button. Also, share it with your loved ones. Until next time, stay happy, stay healthy. Bye-bye.